Hi, my name is Brianna. I will be performing an assessment on Mackenzie. She's a 20-year-old female who goes to Evangel University and is in their nursing program. We are going to be performing a head, eyes, ears, nose, throat, neck, heart, and pulmonary exam on her today. Mackenzie, how are you doing today?
Good, how are you?
Very good. Are you experiencing any types of pain or anything today? No? Very good. We are going to be, I have all my equipment here already, my otoscope, my ophthalmoscope, as well as a tongue depressor and a couple pieces of paper that we're going to be using on your eyes today to assess your vision, okay? It will take just a little bit of time, so please bear with me. Upon first look at Mackenzie, she's well groomed, 20-year-old. It is quite chilly outside today, so she is wearing a cami to keep herself warm, which is very appropriate for the day. Her affect is appropriate to the situation, and her speech is articulate and appropriate to the discussion we're having today. At first, we're going to be assessing your motor and your gait. So can I have you stand up for me and walk over to the other side of the room? We're looking at her stance and her coordination. She's not having any issues with coordination. Her gait is fine. Her feet are shoulder width apart, which is appropriate and helps with balance. Her posture, she is positioned upright and erect, which is very good. No evidence of any spinal deformities or issues. We are going now to be assessing your head, okay? I can see that her hair is evenly distributed over her head. No hair growing any other places that I can see. Very appropriate for her gender as well. I want you to tell me if you have any tenderness when I'm assessing or palpating here. Any tenderness at all? Feeling her occipital bones, her parietal and temporal bones as well. She has an even contour over her head, which the book refers to as normal cephalus. We're now going to be looking at your face. The face is symmetrical. Can you smile for me? Perfect. I want you to raise your eyebrows up really high and that's down. Perfect. Eyebrows are moving equally on both sides and one is not lagging behind the other. Eyebrows and eyes are not crusty, no drainage that I can see. Mackenzie is maintaining good eye contact throughout the exam. At this point I'm going to be assessing your temporal arteries, which is bilaterally equal on both sides, and now I'm going to be assessing your TMJ. Can you please open and close your mouth for me? Perfect. Do it again one more time. Very good, very good. Any pain while you're doing that? No. Okay. I don't feel any type of swelling, and there doesn't seem to be any abnormal movements in her TMJ when she's opening and closing her mouth. I will now be applying some pressure to your sinus cavities. So I want you to tell me if you feel any pain when I'm doing this. Any pain at all? No. Okay. Frontal and maxillary sinuses are not sore or tender when applying pressure, which is a good indication that there's no infection going on at all. We're going to continue the eye exam. I'm going to have you follow my finger with your eyes. We're going to go right to left, or my right to left, sorry. No nystagmus noted. Following and tracking very well. I want you to look at my finger and look at the wall behind me, and then look at my finger. Eyes are accommodating very well. Let me grab, actually my pen light's right here. I'm going to look at your pupils right here. Right now they're at about a 3. And they're responding well to light. They're brisk and equal, constricting to light. Her pupils are round, and her irises are round as well with even color distribution. Her sclera is wide. We're going to take a look at your conjunctiva and pull down. It's nice and pink and no swelling noted. I don't see any lesions around her eyes at all. We are going to do a couple vision tests with you, which is where the pieces of paper come in that I was talking about. So I'm going to have you cover one of your eyes right here, and I'm going to cover mine, and I would like you to, thank you, I want you to tell me when you can see can you see my finger right now? Mm-hmm. You can?
No.
No? Okay. I want you to tell me when you can.
I can see it.
Perfect. Now we're going to switch eyes. I'm going to switch with you. We're going to cover this side. Can you see my finger right now?
Nope.
Tell me when you can see it.
I can see it.
Perfect. And that matches up to when I can see it too. So at least we know part of your peripheral vision is intact. Now let's look at the other parts. I want you to look right here at my nose. I want you to tell me when you can see my fingers wiggle.
No.
And again.
No.
Perfect. Perfect. At this point, I would probably perform the Snellen chart test, which is, I don't have the capabilities, but it is a series of letters on a board. I would have Mackenzie stand 20 feet away and read the smallest line she possibly could, which would tell me how good her vision is. 20/20 is what a person can see at 20 feet away, and it would be a good indicator if she needs glasses or to follow up with an optometrist later on. But since we don't have those capabilities, we're going to be bypassing that test. We're going to be moving on to your ears. I want you to tell me if me touching them at all is causing any kind of pain. What? No, not at all. Looking at both of her ears, the external structures, nothing is swollen. They are pink. Their temperature is warm. It doesn't seem to be any inflammation at all. We're going to take a look at your ear canal. Okay, so I'm going to grab this right here, and I'm going to have you tilt your head to one side for me. Actually, before I do this, I'm going to perform a whisper test. So I want you to look straight ahead, and I want you to tell me what I'm whispering to you.
1, 2, 3.
Perfect. And we're going to do it again over here.
Baseball.
Perfect. All right, now I'm going to take a look at the inside of your ears. I want you to tilt your head to the side just a little bit. I'm going to pull up on your ear just a smidge, and we're going to insert this. And we're going to take a look at your ear canal. Tympanic membrane is a pearly gray color, and it's translucent in the left ear. Now we're going over to the right. We're going to do the same thing. Findings are the same over here as well. Sorry, let me get this so we're not wasting any of that. Okay. At this point, we're going to be taking a look at your nose. So I'm going to grab this again. Looking at the external structure of her nose, it is symmetrical. There doesn't seem to be any deviation at all. I want you to cover up one side, and I want you to inhale for me. Now cover up the other side and inhale. Perfect. Is it just as easy on both sides, in both ears, to breathe in? Mm-hmm. Perfect. Okay, I want you to tilt your head back. We're going to be looking at the inside of your nose on both sides. Okay. The mucous membranes mucous membranes are pink and moist, and her turbinates are the same color as well. They're smooth, pink, and moist, which is a normal finding for the nose. At this point, we're going to be taking a look at your mouth. We're going to look at symmetry of her mouth. Can you smile for me? Perfect. I want to see your teeth. Let's get my pen light out. Would you open your mouth for me? Good job. Okay, can you say ah? Perfect. And I want you to stick your tongue out straight out at me. Good, very, very good. I can tell that her tongue is rough and pink, which is normal. Her uvula is midline, and when she says ah, it raises. Also a normal finding, an expected finding. Her teeth are white and evenly spaced. Doesn't seem to be any crowding or decaying of teeth, and her gums have no lesions or swellings, which is also a good indication of good oral hygiene. I'm going to have you open up your mouth again. We're going to take a look at the inside of your cheeks here. Inside of her cheeks are nice and smooth and moist, a little bit lighter color than her tongue and her gums, but that also is okay. I am going to have you open up again, stick your tongue out. I can also tell that her tonsils are a grade 1. They're able to visualize them, but they're not obstructing her airway by any means. Put that off to the side. Now we're going to take a look at your neck. Once again, we're going to start off by examining, by visually examining her neck. It's symmetrical. There's no masses or lesions or swelling that I can see. At this point, we are going to be palpating your neck. I'm going to be looking at all your lymph nodes. I want you to tell me if there's any swelling, or no, any tenderness when I'm touching. I don't feel any swelling, but let me know if you feel any tenderness. Any tenderness at all? Perfect. Her lymph nodes are small, not inflamed, and they're mobile, but nothing is hard, which is a good indication that there's no infection at all. I'm going to feel your pulse here. Perfect. On the other side. Carotid pulse is equally strong on both sides. I'm going to take a look at your trachea. It's midline. Can you swallow for me? Do it again. Perfect. I can displace it a little bit. Probably a slight just a little bit of uncomfortableness. But now we're going to be assessing your thyroid. I want you to turn and face that way just a smidge. Perfect. Okay. Thyroid's not swollen at all. You can turn back. Perfect. Thyroid's not swollen at all. And she didn't display any signs of tenderness during the exam. Okay, now we're going to be assessing range of motion of your neck. I want you to touch your chin to your chest. Perfect. Now I want you to extend it as far back as you can. And I want you to take your ear and touch it to your shoulder without bringing your shoulder up. Now to the other side. Okay, perfect. Range of motion is slightly limited when trying to touch her ear to her shoulder. It's just a little bit difficult for her. Not quite making it there all the way. I want you to press on my hand. Press, press, press. Again, press. Now I want you to shrug your shoulders. High up, I'm going to be pressing down. Okay, that was testing cranial nerve 11, and she seems to have good strength in her shoulders and her neck. Good muscle strength. At this point, we're going to move further on with the exam and assess your chest. We're going to be doing this, once again, by visually inspecting before we do anything. I don't see any signs of respiratory distress. Her respiratory rate is regular. She doesn't seem to be using any accessory muscles or no labored breathing at all. Patient is not cyanotic, which is a good sign that she is getting enough oxygen to supply her organs and every other system in her body. We are going to, I want you to do a couple things for me. We're going to assess for tactile firmitus. I want you to say 99.
99. 99. 99. 99.
Okay. It's symmetrical anteriorly on her chest. We're going to do the same thing back here. I want you to say 99.
99. 99. 99. 99. 99. 99.
Very good. And the tactile firmitus is symmetrical on both sides on her posterior chest as well. I will be auscultating your lung sounds at this point. I can get them tingled here. Sorry. Once you take some big deep breaths every time I move my stethoscope for me. Okay, pardon my reach. Okay, same on your back. Very good. The lung sounds are clear and nice and strong bilaterally. I can hear breath sounds moving throughout upper and lower lobes on both the right and left side. At this point, we're going to be percussing the lungs. We're going to start up high. Sorry. Thank you. Very good. I'm going to have you turn and face the camera a little bit. Thank you. We're going to be percussing her back. So far, we're getting a nice resonance. Very good. No dullness or flat sounds, a nice resonant sound when percussing. I am also going to have you face straight again. Perfect. Now I'm going to be having you say a couple things while I listen to you, okay? We're going to start off with the whispered pertriloquy. I'm going to have you whisper 99 for me as I take a listen. Whisper 99. Okay, now I want you to whisper it for me, okay? You're okay. Okay. Now I want you to say E every time I move my stethoscope.
Whisper or just say it?
Just say it.
E. 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 E.
Very good. We do not have an E on A phenomena. I can hear E when she says E. When she says 99, I can hear her say 99. However, it is slightly muffled, which is a normal finding. And when you whisper 99, I couldn't hear it, which is also good. All of this means that there is no consolidation or infection in your lungs. All great findings, okay? Okay, Mackenzie, now we're going to be taking a listen to your heart, okay? I'm going to listen to all the valves of your heart, as well as listen to your pulse, the epical pulse of your heart, okay? Okay. All right. So I want you to breathe just normally. Pardon my reach a little. All the valves of her heart sound fine. I don't hear any extra heart sounds. Her aortic, pulmonic, tricuspid, and mitral valve sound perfect, basically. Listening to her aortic pulse or rhythm, her heart rhythm is regular. I don't hear any irregularities, no premature beats or anything along those lines. And that concludes our exam. Thank you so much for being patient with me today.
Thank you.